We are expecting a very busy, active, heavy wildfire season in Washington. And as a result, that means, like we've seen in recent years, a lot of smoke is going to be hanging in the air, and that smoke has some really nasty stuff in it. So the State Department of Health has an urgent message for you, and that's why I am joined by Caitlin Kelly. Caitlin is the State Department of Health's air quality policy specialist. Caitlin, thanks for joining us. The first thing I wanted to ask you right out of the gate is if you could tell us what exactly we tend to find in wildfire smoke that's just so awful for us.
Thanks, Ryan, for having me. The most important thing in wildfire smoke that we are concerned about for health is a thing called particulate matter 2.5. 2.5 means it's 2.5 microns in diameter, which means it is really small. And the particular risk about this is because it's so small, it gets past our defenses in our lungs, it can enter our bloodstream. And so that's what we think about when we have all the health impacts from wildfire smoke. And that is the same pollutant that we monitor on air quality monitors too, and use for tracking wildfire smoke concentrations.
So in addition to the particles, I understand, there's also, I don't want to call them the standard gases, but some pretty awful gases that we can breathe in that I would imagine wouldn't, because their gases probably even get through filters too, right?
Yes, so there are other air pollutants in wildfire smoke gases, other things like that. And those are a particular risk when you are close to the fire, but what travels in smoke and impacts areas when you're not close to the fire is PM 2.5. But you're right, if you are close to the fire and there's other gases, N95 respirators don't filter out gases.
Okay, so these particles, how bad can it get? Let's take it one at a time. Firstly, let's talk about how bad it can be for someone who has heart problems, lung issues, asthma, other breathing problems, or other illnesses. And let's throw in, because they're particularly sensitive, young children and older people. How bad are the problems we can get when we're dealing with those kind of people are dealing with this smoke?
When you have a pre-existing sensitivity, like you said, a health condition, age, you are absolutely more at risk to the health impacts of wildfire smoke. You're likely to experience those symptoms at lower levels than other people. So those minor symptoms like burning eyes, throat irritation are going to happen at lower levels. And as we see higher levels of wildfire smoke, people with pre-existing health conditions or sensitivities are more likely to experience those severe symptoms from wildfire smoke. So headaches, wheezing, shortness of breath, irregular heartbeat, chest pain. And we also know that PM 2.5 can actually lead to hospitalizations and even increase the risk of death.
Yikes, that is some scary stuff. Now, how about for the average folks who might be generally healthy and think, oh, well, I can go out in the smoke for a little while? They're setting themselves up for trouble too, aren't they?
They are. Smoke is not good for anyone. There is no identified safe level of PM 2.5 according to the literature. And healthy people tend to go outside and smoke and think that they are healthy and won't have impacts. And that is certainly not true. You can track those kind of more minor symptoms, so burning eyes, coughing, as a signal that your body is starting to be impacted by the smoke. But we're still learning a lot about the health impacts from smoke. And we don't know what the long-term impacts are yet, because this is a recent couple-year phenomenon. So it's important to take steps to protect your health, even if you're healthy. And symptoms can be experienced a week past a wildfire smoke event. So continue to track those symptoms too, even when the smoke clears out.
I'm glad you said that, because I didn't even think about that. I mean, we think, if a rainstorm comes or the wind shifts and the smoke blows away, we're okay. But if you've breathed in the stuff, it's going to stick with you for a while.
It is. It takes a little bit for your body to clear it.
Unbelievable. So the other thing too, I'm hoping you can address, because we've talked about the particles, and the thing that always sticks out to me when I think about it is how you can breathe these things in, and not only, like you said, do they get past our defenses, but they can get way down in your lungs and they stay there, don't they?
Yes, yeah, it takes a little bit longer for your body to clear those particles.
But they're not, you say clear the particles, we can eventually get them out. I just assumed that when you're talking about getting the stuff lodged way down in there, it's going to stay there.
We do know our body can clear out particles over time. I can't speak to how long that takes. I'd have to get back to you on that one if you want to know the specifics.
I'm sure at some point I'll be talking to a respiratory specialist about it too. We have a way of doing that sometimes as well. So now we need to talk about protecting ourselves from this wildfire smoke and the gunk that's in it. And there are a couple of interesting techniques in terms of what I've been calling cleaning your indoor air, because I think that the big advice obviously is you want to try to avoid going outdoors if you can help it. But then you're indoors and you need to get that air clean. What is Department of Health recommending for that?
You're right. Your indoor air quality is the most important during a wildfire smoke event, especially as you come inside and you're spending time inside, and the wildfire smoke events are getting worse at higher levels. So the smoke gets in our home. So to keep it clean at a good quality, we have to filter out the smoke. And so there's a couple ways to do that. The first is if you have an HVAC system, trying to upgrade your filter to at least a MERV 13 filter that will filter out the fine particles and wildfire smoke. But not all of us are lucky to have an HVAC system. So kind of the next step or next option is a commercial HEPA portable air cleaner. Those do run about $200-ish, depending what size and quality you get. Those will filter out the smoke in a single room. You kind of close off the room, you run the filter. It has to be rated for the size of the room that you use it in, has to have a true HEPA filter. You don't want one that produces ozone. So there's some considerations to like doing some homework to these things. And then the lower cost option is a DIY box fan filter kit. This has gotten a lot of attention recently. And so if you have a 20 by 20 box fan, basically you grab a couple MERV 13 furnace filters that you can get at a hardware store or online. It should be at least a MERV 13. And there's a couple options to constructing them. You could duct tape one filter onto the back of the fan. You can make a triangle with two filter, or you can make a cube. Lots of options depending on how many filters you have and what size of space you're using it in. And it's one thing that I would just emphasize is that those materials or the portable air cleaners sell out if the smoke hits and it's smoky outside. So get your materials in advance this season.
Yeah, like I was telling you before we started, I do have one stashed in the closet, but now I'm going to be going over to the local hardware store tonight and trying to score a couple others. And I didn't think of the idea of the triangle, like you said. I've always just put it, straight on the back with, well, we don't have duct tape. In the radio business, we use gaffer's tape, but it does the same job, works very well. But the triangle, that seems to me would be even better if you can make that work. Now, you said you used the term a couple of times, at least a MERV 13 filter, and I was thinking about that too before we talked, because I'm wondering, I know MERV 13 is sort of a minimum level, but is there a point where it might be too much filtration?
It depends on the context that you're using it. So if you have an HVAC system, some HVAC systems can't handle a high MERV level filter. So it's important to look at the instructions or consult an HVAC professional. For the box fan filter kits, we typically recommend a range between MERV 13 to MERV 18.
Okay, good to know, because the other problem, like you mentioned, is they sell out. And if the MERV 13s aren't there, then I could get a 14 or a 15 or a 17 and still be in good shape, because you still also want to get clean air going through. And that's what I was thinking about, is you don't want it to be such a heavy filter that you can't get enough clean air then coming out the other side. So I think we've covered most of the basics. Caitlin, what have I missed here? What else do people need to know?
One of the other things that I would just recommend is having a good resource for where to get your air quality information and information about wildfire smoke. There's a lot of websites out there, but the best that we have in Washington is the Washington State Smoke Blog. And it's a one-stop shop. So we have information about the air quality. There's forecasts for up to 5 days. So you can make a decision about the upcoming weekend if you want to go backpacking or spend time outside. It has the location of the fires. It has our health information. It even has narrative blog posts by experts in Washington when it's smoky outside. So you can actually engage with experts themselves.
And that brings up one other thing I want to ask you about, because I was looking at the air quality map just a little while ago, and I noticed there were a couple of little yellow spots in areas where there's traditionally, near the port of Seattle and the Duwamish River, where there's traditionally a little more pollution in the air from the trade activity that's going on there. But the thing I noticed too is when it goes up, the green level is the good level, the next level up is yellow. Even just getting to yellow can be a problem for some of those sensitive people, it looks like. Am I right?
Yes, you are right. At the moderate level, people that are especially sensitive, so if you have maybe multiple health conditions or just a lot of other things going on that make you more sensitive, you could be experiencing symptoms at the moderate level. So all sensitive groups should watch for symptoms at moderate and be ready to reduce their exposure if need be.
And I think that's the most important advice too, is avoid going out, right? Avoid going out in it.
Yes, and that's the best thing to do, and then be inside with clean indoor air. But it's also hard. There's groups that can't reduce their time outside. And once we're inside, we also have to think about heat too. And so it is that's why it's important to prepare for smoke in advance. Know how you're gonna stay cool inside. Know how to maybe get some physical activity inside too if you're not be able to spend time outside. So have a plan in place.
And the other thing too, we all need to remember, all of us got used to wearing N95 masks because of the pandemic, but those N95 masks were originally designed to filter out dust and small particles like what we find in smoke. So you'll definitely want to keep those handy as well. Caitlin Kelly with the State Department of Health, thank you so much for that. Really appreciate it.
Of course. Thank you.